Didn't know I was last. Wow. Okay, I've got the most exciting topic that everyone's talking about right now. When you go into high school, all the cool kids at the cool table, they're talking about the celebrities, we're talking about it, all these athletes are talking about it. Data security. It's exciting stuff. All right, it's not that exciting, but it's important. And it's especially important in the healthcare industry. So in the healthcare industry, if you have a data breach and patient's data is lost or gets out into the public, there are a lot of consequences. $50,000 fine minimum for the first violation. And then you've got to contact these patients. There's negative publicity, just a PR nightmare. And then the worst thing is you're really losing the faith of your patients. And that patient information is very important. Now, one thing that all those cool people that I talked about before are doing is sending text messages. So texting has become the new phone call. We don't talk to each other on the phone. It takes too long. Every time your phone rings, you have to stop what you're doing, pick it up just to find out that it wasn't really that important. So people text all the time. It's our #1 way of communicating. In the healthcare industry, that's not an exception. But the problem is, it's against the rules. Everyone's policy is no texting in the hospital, no texting patient information in your private practice, in nursing homes. So what we've done is create a secure way of texting. They download our app, the enterprise pays the license per person. It's all secure, cloud-driven, a mobile app for iPhone or Android. They invite their users, and they can start communicating the way they already want to communicate, only in a secure environment. Now, we've added some nice bells and whistles. We've got some quick responses, so that those things that you're responding to all the time, those same messages that you're typing and typing and typing, that you can just do that in 2 taps. We've got advanced read receipt, so when you send that group message out, you know exactly who read it and what time they read it. So before doing things like that, you send a text and somebody just never gets it. Oh, I didn't get that text. Well, when you put that read receipt there, you find out that people actually do receive their messages. The next thing we're working on is location awareness. So in the hospital, if you go to any nursing floor, they may have 40 nurses that work on, say, 4 South. But they're not all there right now. Only 10 of them are there right now because they work in shifts. And if you're sending a message that's important because you need something done in room 403, then let's just send it to the people who are actually in the hospital. So what we've done is we've identified where their location is and who's in it, so we can send it directly to the people who can actually help. Thank you. Questions?
So are you testing this program anywhere? Is it rolled out at this point, or what stage?
The question is, are we testing it anywhere, or is it rolled out? We do have our first paying customers. We have a handful of nursing homes that are using it. We have started our first free trial with a hospital. We have also formed or have an agreement with the state of Louisiana, the Louisiana Hospital Association. We are their vendor of choice, their preferred vendor. So we're working a lot in Louisiana. We've also been trying to do some similar things in Georgia, try to be in our backyard here, and then we'll tackle the Southeast, and then we'll move nationwide after that.
So I understand with HIPAA and a lot of the different compliance that you've got a unique way of getting around that, where text messaging wasn't acceptable?
Sure. So the question is around HIPAA, and do we have a unique way of getting around the HIPAA regulations? We do not have a unique way of getting around the HIPAA regulations. What we've done is we've built it so that our platform abides by those HIPAA regulations. So we keep things secure, we audit messages, we audit who read it, we do all of those things. And we have invested a lot of time and money in processes and procedures and getting audited by a third-party company to make sure we are, in fact, HIPAA compliant.
Database mining, probably, you do things like you capture all those texts, you organize them certain ways, you provide alerts about these configured
question is around data mining and what are we doing with the data? Are we reporting on the data? We treat these messages as conversations, as phone calls, as hallway conversations. So this is disposable information. We're not replacing an electronic medical record by any means. This is really just trying to streamline the communications. Now, to that point though, we have built it so that it can be integrated with a rules engine that's running on the electronic medical record that is data mining lab results and vital signs so that they can send a message through our system and hit the right person at the right time.
Is that an opt-in type thing? Because HIPAA said Joe should not get that information. Do you have that structure?
So the question is about structuring the permissions of people so that only the right message gets to the right person. From the texting situation, you can only send messages to people who are in your organization. So the administrator would define who is in the organization. So I can't send it to my buddy who works at a different hospital.
It's an opt-in type of thing.
Correct. Other questions?
Cash,